In Blantyre in Lanarkshire, the GP waiting room was empty, although the GP was here. All doctors went to work today, they just didn't see anyone except for emergencies.
Well, actually the GP contract is very complicated. We don't get paid in a time. We get paid for the work we do, so the routine work we do will still be done.
I don't think it's committing a lot of disruption. We've brought somebody up here today and I don't know anybody who's been disrupted with it.
They provide a good service, and you know, they deserve what they're on strike for.
There was one old-fashioned picket line. It was outside the British Medical Association's own Edinburgh office yesterday. Backroom staff were on strike. The BMA closed the final salary pension scheme for its own administrative staff in 2003.
Please, Mr. Roberts up there.
Were doctors right to strike, or should they be more willing to play their part in reducing government spending?
Were they right to strike today, or should they be more willing to play their part in reducing spending? Len McCluskey.
Yes, they were. The doctors are just the latest of a number of public sector workers who've rejected the government's attempt to steal money out of their pension funds. Remember, the government's plans are to make public sector workers pay more, get less and work longer. And there's no legitimacy for it, because the pension funds that are there to govern what public sector workers get are sustainable. That argument that the government put forward at the beginning of this campaign, that it wasn't affordable, was blown out of the water. And I've no doubt that there'll be people on this panel will want to attack doctors, want to attack public sector workers. And I would say that we shouldn't demonise public sector workers. Public sector workers are the people who teach our kids, heal our sick, care for our elderly, our vulnerable, encourage our youth, clean our streets, collect our refuse, the very people who create the civilised fabric of the communities in which we live. They didn't cause this crisis. Private sector workers and ordinary people didn't cause this crisis. It was the spibs and the speculators. It was the spibs and the speculators, David. The spibs and the speculators, the greedy fat cat bankers and CEOs in boardrooms who caused the crisis. And the government should be attacking them, not decent men and women.
Are you saying there's... are you saying there is no financial problem at all with public sector
There is
pensions?
no financial problem whatsoever.
I see.
The deal that was cut back in 2008 with the then Labour government, pensions is highly complicated. Actuaries go into some depth to see what the cost is, and the scheme, all schemes that cover all our public sector workers are in surplus and are not affected by the all the government are doing is they're simply stealing out of workers' back pockets. And why? We'll hear all the stuff about gold-plated pensions. In the National Health Service, the average pension is £4,000.
Right.
Same in local government.
Well,
doctors work...
Let's hear the government's view on this.
8 years doctors have to go through to get... Do any of us trust our doctors here? I suspect we all do. They work hard, they get a decent pay, they put into a pension scheme so that they can have dignity in retirement.
Len,
and they didn't
thank you very much.
It.
I'm going to ask Ken Clark to comment on this. Ken.
Well, on the question, we'll find out tomorrow. I think we'll find about 9 out of 10 doctors will have decided that this was one of the more silly things that the BMA has decided to do for a very long time.
Get your facts straight, Ken.
No.
Get your facts straight. As part of the GDP, which is what the pension schemes are based on, and the actuaries going forward, experts in pensions, not only is it affordable, it's actually coming down.
All right.
We have a fundamental disagreement of fact. But
let me bring Andy Burnham in, because